Yes, yes, and I have been instructed to stay on stage to also present you our next nominee in English. And she is a global citizen, very passionate about changing larger systems and driving policy change. And actually, I also can say that Amira has sacrificed a nice conversation with Hail Berry to be with us here tonight. Amira, come and join me here on stage. Very warm welcome. Have a seat, so you also have a microphone.
Thank you, and hi, everyone.
So you have over 15 years of experience in policy change, ecosystem change, right? You work at the World Economic Forum, actually is really to drive basically systemic change. What are you most passionate about?
Yes, and thank you for the invitation. It's really an honor to be here tonight. So I've always been passionate about providing quality, accessible and affordable healthcare for the most vulnerable population. I like to say that illness doesn't discriminate, so health is a human right that we should all have access to. And I've always been driven by providing, healthcare to all people, especially the vulnerable population. And then what came to women's health specifically, it's during the COVID pandemic. It was not so long ago. There was a lot of stories, data, reports that came up that really showed how much women and girls were neglected, abused, left behind. And sorry, I don't mean to, cut the good energy, but those data have to be shared. And we've seen like the increase of femicides across the world, whether it's the global south or global north. And we also saw the increase of domestic violence, the increase of unwanted pregnancies, because family planning services were not considered as essential services, so women could not access contraception. They could not access essential services when it comes to reproductive health. And also, we've seen a lot of girls who couldn't return to school just because they were stuck at home after the lockdown measures were out. So all of this just to say that I've always been really passionate and driven by helping the vulnerable population, and women and girls tend to be left behind.
Yeah,
yes, and maybe a few words regarding the Global Alliance for Women's Health, and this exactly at this time, this led me to build from scratch an alliance that brings together different stakeholders, whether from the public or private sectors, to really help us move the needle and improve and prioritize and invest in women's health. And it is now a global alliance that has over 135 dedicated members. It is co-chaired and sponsored by the Gates Foundation, and we are invited to increase awareness around women's health in global platforms such as the G20, the G7. Earlier this week, I was at the UN Palais to increase awareness around this important topic. And I've seen, across the different nominees tonight, that women's health is actually a topic of priority of all of us. So I'm very glad to hear that from all of us.
And what would you say are kind of the biggest myths around women's health, right? What does need the most addressing? Where are the misconceptions?
There are a lot, unfortunately, but I will only highlight a few ones. So the first one is I'd like to share the right definition of women's health. So women's health is not just bikini body or reproductive body or bikini science, right? It's way beyond that. And the way we define it with the Alliance is to look at three different ways. The first one, we look at conditions that affect women only, so everything with menopause, endometriosis, maternal health. The conditions that affect women differently, so women and men don't necessarily have the same symptoms when they suffer a heart attack. So it's really important to highlight those conditions where women are actually, they have the different symptoms than men. And the last piece is around conditions that affect women disproportionately. You mentioned Alzheimer. It's a condition that affects women more than men, or back pain, or mental health diseases. So that's really the first misconception, is how do we define women's health? And the second one I would like to share is around the longevity, or the health span and the lifespan of women. So we indeed, women indeed live longer. I think we all agree with that. But our studies show that women tend to live 25% of their life in poor health. So there's really issue around disability and affecting the health span of women. So those are the two ones I wanted to highlight, but there are a lot more.
Now, your work at the World Economic Forum consists of bringing stakeholders together, enforcing dialogue, building new connections. From your really broad perspective, what do you think would need to happen to actually shift the needle for women's health? Is it more money? Is it more collaboration? Is it lacking policy? What would kind of address these challenges that you mentioned?
That's a great question. So from our studies, there are four root causes for the women's health gap, and we'll need to address all of them. The first one is the data gap. We are still not familiar with the female biology. It's under-researched and under-resourced. The second one is around the research gap. Of course, we need more science and good science for women so that we have the right solutions and we have the right treatments. The third one is funding. Of course, we need more investment in women's health. And the last one is a very important one, which is around the care delivery gap. We've all heard women going to their healthcare providers and saying like, oh, maybe you just need a vacation, or maybe you're just tired, maybe you have a lot going on at home or at work. So there's a lot of bias happening in, with healthcare professionals, and they are not necessarily trained. For example, I mentioned the heart attack. They are not trained to recognize the symptoms of women, but only men. So this is a huge issue. And we need cross-collaboration, for those gaps.
And so at the World Economic Forum, what concretely are you doing to help, besides providing, of course, very helpful research? Any other activities that you would like to highlight here?
Yeah, for example, next week, we are hosting a workshop in collaboration with the Health Ministry of Nigeria on maternal health. We know that the rate of maternal death in Nigeria are the highest across the globe. So what we do at the Forum and with the Alliance is that we are bringing together stakeholders from the public and private sectors who will be able to support the public health priorities with maternal health, with investment, with resources, innovation, knowledge, and expertise. So we have a lot different programs, but just sharing the one for next week.
Plus some other exciting projects, as you shared over dinner, right? And I don't know if you want to share that on stage, but let's see if we get any questions from the audience. Anyone? Oh, look. There we go. So let's start. Why do you think women's health has been historically underfunded in medical research, and how can we change that?
Yes, so there are a few reasons for that. The lack of data, the lack of awareness around the issues that women are going through. Until now, just menopause, it's a taboo topic, right? So there's a lot to be done around that. But I would say what we can do here, the first one is to highlight the economic benefit of investing in women's health. And this is what we did by launching a flagship report that demonstrates if we are able to close the women's health gap, we could boost the global economy by $1 trillion each year. So if we invest in women's health, it's good for everyone.
Now, we have some questions here. Let's see if you care to comment. You've just traveled in from New York. We know it's a very different environment for diversity and inclusion. It's changing. Being just freshly back from the States, how do you see this?
So, to be honest, the women's health space has always been challenging. We could see in the research space. Women were included in clinical trials only in the 90s. So nothing really new, I would say, but I think it's an opportunity for us and for everyone to double the efforts with regards to women's health. We need to do more. We need to increase awareness. We need to increase visibility of the work that we do at Roche, at Nestlé, or other organizations, all together, really to come up with a common vision to support women's health.
So, and international institutions are under pressure today. Is there any sentiment you would have about kind of the larger bodies, like, you know, larger organizations and their role in playing in addressing this issue?
So I wouldn't be able to speak for my colleagues at the UN agencies, but what I can say with the World Economic Forum is that we are a neutral and independent platform. We work with WHO, for example. We have some discussions around supporting a revision of the WHO resolution on clinical trials. So it's really a difficult time, but we, with the forum, we are in a position to really support different entities and organizations in this topic, which remains an important one.
Now, we spoke a lot about larger system change, right? What is your view? What could each and everyone in the room do to advance the cause of women's health?
Yes, great question. A call to action to everyone. So I think it depends if you're in the pharma industry or other industries. I think you're already doing a lot, especially in the research area. But on an individual level, I think let's keep the conversation. Let's keep the momentum going. I think it's great that every woman is able to share their own experiences. When you go to your healthcare provider, your doctor, ask questions. If you're having some symptoms and it's just you're tired or anything, go further, ask for a second opinion. Let's make women's health a topic that's not taboo anymore, that's really deserve to be elevated in the right platforms, and that deserve investment and simply being prioritized. So all of us, let's continue the conversation. Let's make it just a normal topic to address.
And having traveled in freshly from New York, what is next for you? The one next exciting thing?
So as I mentioned, we are next week in Nigeria with the health minister to address maternal health. We would like to expand our work in Southeast Asia because the needs in Indonesia, for example, are also very big. We are hosting a health annual summit in May in the occasion of the WHA week. We have a lot of different programs, but I would say it's really to keep the discussions going, to make sure that we bring the right people around the table asking for the right topic, and only then we'll be able to really progress with regards to this topic. It's having the right people who have a common vision.
And I feel you full of purpose and energy. Best of success and luck with everything you're doing. Amira, thank you so much for being here on stage with me tonight. Thank you.